Good day, sir. I'm Chris Medaltayo, your nursing aide for today, and today I will going to perform routine catheter care. The purpose of this procedure is to minimize the trauma and infection risk associated with a urinary catheter. Then, equipments, materials needed, soap and washcloth, anti-infective solution, antibiotic ointment, sterile swabs, forceps, tape, measurement container, sterile gloves, and sterile drape. Then, the goal, the client's urinary elimination is maintained with urinary output of at least 30 ml per hour, and the patient's bladder is not distended. Then, for assessment, first we are going to determine how long catheter has been in place. Second, observe any discharge or incrustation around urethral meatus. Assess for complaints of pain or discomfort. Then, next we're going to wash hands. Then, for planning, prepare materials, equipment needed. Then, for implementation, after wash hands, close curtains around bed or close the door of the room if possible. Then, for next, we are going to organize equipments for perineal care. Afterwards, we are going to position the patients correctly and cover the perineal, cover with bath blanket, exposing only perineal area. Then for female, dorsal recumbent position. Then for male, supine position. Then next, we're going to place waterproof pad under the patient. Next, drape bath blanket on bath clothes, so only perineal area is exposed. Next, open sterile catheter kit using a sterile aseptic technique, then put on sterile gloves. Afterwards, we're going to apply sterile drapes over patient's perineum. Next, pour antiseptic solution on cotton balls and swabs, and apply antiseptic ointment on cotton balls to check patient for allergies on antiseptic. Next, with non-dominant hands, we are going to gently retract the labia majora for female client to fully expose urethral meatus. Then, the catheter insertion site, maintain position throughout the procedure. While in male patient, we're going to retract foreskin of uncircumcised male client and hold penis shaft below the glans, maintaining this position throughout the procedure. Then for next, we are going to assess urethral meatus and surrounding tissues for inflammation, swelling, and discharge if it was present. Then note for the amount, color, odor, consistency of discharge, and ask the patient if he feels burning or discomfort. Then next, we're going to cleanse the perineal tissues. For female client, use separate cotton balls and forceps to cleanse each lovium majora, moving down to the anus. Repeat process to cleanse each side. Then for the male client, while spreading the urethral meatus, we are going to cleanse first around the catheter. Then use clean cotton balls to wipe in circular motion around meatus and glands. And next, reassess urethral meatus for any discharge if it's present. And next, get new cotton balls and wipe in circular motion along the length of catheter for about 10 centimeter or 4 inches. And next, apply antiseptic ointment at urethral meatus along 2.5 cm of catheter. Next, we're going to replace adhesive tape that anchor catheter to client as necessary. Then we're going to remove it and residue from the skin. And afterwards, replace urinary tubing and collection bag adhering to principles of surgical asepsis as necessary, but at least 8 hours. Then, afterwards, we're going to check the tubing. The drainage bag, no tube should be coiled, kink, or clamp. Then, collection bag is emptied as necessary at least 8 hours. Then, assess the client's safety, and then if he is in comfortable position, and we're going to dispose the contaminated gloves and supplies, and wash hands. Then for evaluation, we're going to inspect condition of urethra, note for the character of urine, and assess client's temperature. Then next we're going to record on nurse's notes when catheter care was given, assessment of urethral meatus, and the character of urine. That's all. Thank you.